I don't want to necessarily say what it should have been, because again, what's very important in prostate cancer is that it is necessary to balance the oncologic risk, meaning the risk of the cancer to one's health, but also balance that with the side effects of screening and treatment. And so the way that I think most providers would have this conversation with folks is that, yes, for the vast majority of men over the age of 70 or 75, in the absence of specific symptoms, which are rare, that there is not much oncologic benefit to screening over that age with the average life expectancy of most males. But with that said, in 2025, we are seeing men live to well into their late 90s, well past life expectancy projections, in generations past. And so it is very reasonable in a man who's going to live 10 years to treat them as if we were, still within that 50 to 70 to 75 window and screen them either annually or biannually. I don't necessarily see men commonly slip through the cracks of that, to be honest, in terms of getting a late stage cancer diagnosis, and realize that the guidelines are there to help the majority of men, not necessarily all men. The guidelines are written to reduce harm and to increase, diagnoses of clinically significant prostate cancer in as many men that are possible. Um, I think that I think it's a very nuanced discussion. I think the most important thing that one should take from the president's story, and again, without understanding necessarily his specific goals and all the nuance to his specific healthcare file, I think that what's important to know though is that screening is not the same thing as treatment. Screening is information, and it is the job of the urologist, and the medical oncologist, the radiation oncologist, to parse through those numbers and apply it to one, or to apply it to the individual that they're caring for. So I tend to favor more intensive screening, not necessarily over screening, but I view screening as a tool to gather information, not necessarily to utilize that information simply to diagnose a cancer and treat it. At least, though, I know how to follow a patient if I have more information to better risk stratify them.